right. Well, it was quite a powerhouse. That was excellent. Thank you all. We have some very good questions that we can get through, and I think we have about a couple each. So I think if we go through it all, we should be able to get through them together now. The first question, I'll go to Sarah for you. The question is, for people who are autistic or who have executive function differences, the self-management tasks of chronic illness like scheduling, rest, medications, or appointments can be extra hard. What approaches help balance those needs?
Right into my favorite subject, thank you. So there are coaches out there who specialize in ADHD coaching specifically. Executive function is also known to be a difficulty even without that diagnosis with all sorts of chronic illness, particularly Ehlers-Danlos, so it's definitely difficult. Color coding is very, very helpful just from a visual cue side. I have sticky notes all over my mirrors because it's very visible. That works for me. It doesn't work for my husband because they disappear for him and his brain. So it is very much about finding what works for your brain, not someone else's brain. I would also recommend any book ever written by Dr. Hallowell on the subject of ADHD and executive functioning, but wherever streamlining is possible, so asking your physician, for example, if you have multiple medications, what can be taken at the same time, what absolutely needs to be spread apart. I have so many patients who have interpreted my instructions as meaning it's like a medicine every 15 minutes. I never mean that, first of all, but anything that can be streamlined with that assistance is a good thing. I'm sure everyone in here already has a pill container with all the right, Monday, Tuesday, Wednesday, but there are a million, so much more, I'm going to call them fancy options if you look on Amazon, that have timers, that have counters, that have the option of taking one slot out with you if you're going out, of town but don't need the whole week's worth. So again, very personalizable is really my bottom recommendation. And make sure that you are with a psychiatrist or a primary care physician who is very well versed in helping to manage those symptoms, both in terms of making sure you have the right therapist as well as coach. Those are two different roles, but a psychopharmacologist, someone really skilled and knowledgeable with the medications for ADHD, et cetera, makes a world of difference. And if you're with someone who doesn't know those nuances as well, you might think you've tried everything and it's not working, but it might be because of expertise.
All right, well, now that we've got you warmed up to that topic, I want to do a follow-up because I think it ties in well. What tips do you have for neurodivergent parents who have neurodivergent kids who may be struggling with recognizing their own symptoms and patterns and management of their own?
You mean if the parent is undiagnosed?
Oh, if there's a neurodivergent parent with a neurodivergent kid and they're having issues recognizing and balancing their own issues.
Ooh, that's hard. I think in that case, making sure that you have a very strong family therapist so that there is somewhere to offload some of that stress as a team approach. This dynamic does not stay in childhood, it follows you into adulthood. So the more you put into that piggy bank of finding communication skills, the better. There are some kids who are really struggling both with the chronic illness aspect and with the neurodivergent aspect with the overload of task demand. There's a newly described concept of pathologic demand avoidance. I am not going into the accuracy of the new research about that. That's a huge subject. But conceptually, the idea is that for someone who's neurodivergent, they might be easily overwhelmed almost to the point, or even to the point that they feel that their body is out of their own control if asked to do something that they perceive as not as a threat, but as a demand on their body, like they're no longer in control. And that can lead to very significant burnout, both for the parent or for the kid. So if that is something that is affecting interactions, having a set framework of rest time, for example, where you turn an alarm off and nobody talks for an hour just to purely rest, and there are no demands on the brain during that time, or this period of the day is when demands are done. So this is the period of the day where we're going to have a family meeting, and it's only 20 minutes, don't make it too long, and you're going to work out the most important things during that time and that time only, so it doesn't spill into the rest of your day-to-day life, because this can take over. So, and that's easier said than done, obviously, but that would be my starting point.
Fantastic. Thank you, Sarah. So, Valerie, I'll go to you now, as I know you've shared lots of tips and tricks as well. So, this question, and there's a quick follow-up to it too, but I'll start with, as someone with a chronic illness, I often carry the mental load for my family as well, planning, organizing, remembering everything, including my children's health conditions. How can I manage that responsibility while also dealing with the constant medical tasks of my own illness?
I think that's an awesome question. I'm glad that you brought that up. I think that getting to the aspect where we're writing down certain aspects of our health can be very helpful for helping to manage for the whole family. The reason I say that is because it takes some of the responsibility off in the moment emergencies or as you go to those appointments. So I hope that that is a helpful solution for some of this. I do understand that's a huge undertaking, but I also think it's a great opportunity to help educate your kids as well, how to be a bit responsible about updating, their written form or whatever it may be, so that they can learn to advocate for themselves.
Thank you so much. So the quick follow-up then is, if I am a patient who has all of these medical things that I'm bringing to my appointment, one, is there a better option? Well, first, bringing extensive documentation to my medical appointments. A few of my doctors have documented in their notes that I'm overly preoccupied with my health. How should we present the info to health practitioners without risking being perceived or dismissed as hypochondriacs?
I think there's two avenues to address with this. First of all, it's not overkill. You need to be confident enough in yourself and your self-advocacy to know that you're doing what you need. You can straight up tell the practitioner something like this. Tell them, this is too much for me to manage. One of my symptoms in itself is my brain fog, and this is the only way I'm able to get through these appointments successfully. If they have respect for their patients, then I would assume that they're going to take that a bit differently. The second aspect I want to address with this is that not all doctors have to be the right fit for every patient. So if somebody is finding that their notes are condescending in a way or dismissive, move on and find another doctor. And that doesn't mean that the doctor is not a good one. It means it's not a right fit, and everybody's allowed to have that.
Great, thank you. Laura, I'll go to you now. I know you provided lots of resources as well as and things. So this question is for Canadians who are dealing with chronic pain and fatigue, but don't have a diagnosis or a doctor willing to prescribe mobility aids. Are there organizations that can help with setting up menu schedules, decision trees? Sometimes my executive dysfunction won't let me ever try to build these tools.
I think looking for community is what made the biggest difference for me. I spent a considerable amount of time undiagnosed, and it was truly the community that helped me share those tools that they had already created, so I wasn't starting from a blank page. And it's something that now I'm able to give back to the community as well, which is a very important aspect of my mental health, is helping someone's next steps be easier than mine were. So community was a very, very important factor in being able to build all of those skills, especially in the maps and menus that were mentioned in the two other presentations of this block. Coming together, really have each other's validation and each other's judgment-free understanding that has been just indescribably important in my path forward. And the generosity within this community is really something to tap into. Wonderful.
Thank you, Laura. Sarah, can you tell us more about the PhysioLine intensive program?
Sure. So PhysioLine is a program through Prism Spine and Joint developed by Dr. Alyssa Zingman, our founder and CMO. Over the course of many years, she developed a corrective exercise program that essentially is intended to meet you where you are, starting point with, understanding that many people spend a lot of time unable to move, so taking that into consideration, and starting with very, very small movements in order to build a safer core routine for your body, so relearning habits. And in terms of the intensive aspect, so we're located in Silver Spring, Maryland, and depending on logistics and budgetary constraints, we work with you to develop a program that is unique to your needs in order to give you several days worth of appointments kind of back to back, not literally all day, every day, that would be insane, but meeting you where you are. And that, from a systemic standpoint, that would mean starting with one of our physicians, seeing one of the physical therapists, athletic trainers, et cetera. But it's difficult to get into too much detail because it's going to be unique to the individual. And that can be signed up for online through our new and I think launched website at prismspineandjoint.com.
Wonderful, thank you, Sarah. Valerie, I'll go to you. This is a very practical question, but I think you'll have some insight for us. Is there a better option, I guess we're speaking about medical records and things, is there a better option besides a tote bag or a backpack to bring the extra stuff you have to bring with you to appointment? The tote makes my shoulder subluxate and the backpack really hurts my neck and traps.
Fantastic question, and that's something that a lot of people run into, and so it's a completely valid concern. I personally keep mine within a pouch so I can switch from bag to bag, depending on how I feel that day. I often use forearm crutches, so I a lot of times use a backpack purse. I've shifted that shape and whatnot, so you have to play around with what sort of bag is going to best help you in your case. I also, in college, took some time using a rolling bag. They do make adult ones, for the record. So that can be helpful for some of the strain of some of the bags that people do struggle to use. The other option is having either someone delegated to keep these items for you, or if you leave them in your car. My recommendation, though, for these things would be have something on your body that says where they can find the emergency medicine or your resources. That way, if you are not with them directly, they would know where to find them.
Perfect. Thank you so much, Valerie. Laura, these last couple questions for you then, if we can get to them. Do you have any specific studies you refer to frequently on the benefits of accommodations that may sway employers to implement them? And also, do you have any OT recommendations in Ontario?
So for OT recommendations in Ontario, I'm unfortunately not yet connected to OTs across Canada. I know that I've come into contact with a few through EDS ECHO programs, and I would assume they are now on the EDS healthcare website that has us all listed. I'm sorry, could you remind me?
Yeah, any specific studies you refer to frequently on the benefits of accommodations?
There are some recent meta-analyses that are being done. If you were to Google follow those exact terms, you would be able to find them, and some are listed in small print at the bottom of my slides, which I believe will be available. And those speak towards the ability to access these and how those accessibility improves things like productivity, workplace environment. So all of those mentions of the studies from the slides have been cited within the PDF.
Perfect, thank you so much. And lastly, are you familiar with the Institute for Work and Health's JDAPT? And if so, is it comparable to the BC Cancer Guide you'd mentioned for self-assessing job demands?
I am not familiar with that specific tool, but what we would really be looking for is something that helps guide the thinking and breaks down task by task, a different body system by different body system, what would be demanded of your body in that workflow. So the longer the better, and if there isn't something that is applicable to your job, you can skip down to the next section, but it's really to foster that in-depth thinking.
Perfect. Well, with that, I think we can thank our speakers and we'll go to break now.